Let's cut the heart in half and look at the internal heart anatomy. So here it is, and this is an anterior view. When you're given a picture of the heart cut in half, typically it is the anterior view. However, we're going to be looking at cow hearts in lab. You've got to be able to learn to identify front and back. One helpful hint is finding that apex, right? That's got that kind of pointy end down there compared to the base. And then you're going to need to help with the vessels, have help from the vessels and chambers to identify what is anterior and posterior. So what I want to do first is name the 4 chambers that we've already named. Here again, we're looking at a patient. So here is their right side and here is their left side. So then you could name the 4 chambers, right? Got the right atrium, right ventricle, left atrium, and left ventricle. Separating all of these chambers, forming them are called septa. So here is a ventricular septum. The atrial septum is kind of hidden up there. This is also a septum. And in the septum, there are going to be some holes, so valves. They're going to allow blood to pass through from one chamber to another. So I'll come back to those. Before that, I want to go back to starting with the right here and walk through these structures. So what did I just point to? That's the superior vena cava. Inferior is down there. That is draining blood, receiving blood from systemic circulation, deoxygenated blood, which is shown here in blue. So that comes into the right atrium, which then is going to pass through a valve. Just going to name it valve for now, into the right ventricle. The right ventricle, fairly muscular, it's going to contract and cause blood to flow out through this valve into the pulmonary trunk, where it's going to go pick up oxygen. It's going to the 2 lungs here. It's where the divider is. Another valve that we have to go through. Every single chamber is isolated from other chambers by valves and by the vessels. Blood goes off to the lungs and comes back from the lungs. Now with oxygen, it's going to come in here. So lungs, we could actually have this and there. Comes back and enters through the pulmonary veins. These are deoxygenated veins. I'm sorry, oxygenated veins. They contain oxygen even though they are veins. Entering the left atrium, we now have oxygen in our blood. The left atrium is going to hold the blood for a little bit. Then it's going to travel through this valve to the left ventricle. Left ventricle is very muscular, very strong. It's going to contract and force blood out through the aorta. And I believe I actually have some of these that are going to pop up in a moment too with labels. Through another valve. The valve is hidden back here, but there is a valve separating the left ventricle from the aorta as well. From the aorta is then going to go to the systemic arteries, both an abdominal aorta that goes down and an ascending aorta that goes up. Okay, I'm actually going to erase, let me see okay. Here are the names of the valves. I'm going to clear all this so we can see this better. So I told you there are these 4 valves. Here they are with names. These 2 that separate the atria and ventricles are called AV valves, atrioventricular valves. Tricuspid has 3 pieces to it. We'll see that a better view in a moment. And the mitral valve is the other one, or bicuspid. It has 2 pieces to it, left atrioventricular and right atrioventricular. So those AV valves have certain structures to them. You can see already some of these structures. I'm actually going to name one more right now while we're talking about this. This right here, this is our papillary muscle. It's the muscle that's going to pull down on these cords right here, which are called chordae tendineae. And these structures are going to be important for how these AV valves function. Then I already had these pop up. We have these semilunar valves. That's the other two. The only one in the view here is the pulmonary semilunar valve. The other one is the aortic semilunar valve, not shown here because it's behind that trunk. And these you can see have a different structure to them. There's no chordae tendineae holding onto them or papillary muscles. They're going to work a little differently. I'll go over the valves in just a moment. First, let's do a learning check. You know the names of the 4 valves, and there's 2 groups. And let's look at what happens to them during relaxation and then contraction of the ventricles, which is when they're going to change in the 2 states. So first, this is ventricular relaxation. So it's also called diastole. The ventricles are relaxed, not contracted. And during this time, what's happening is the left and right ventricles are filling because they're relaxed. So the atria fill with blood returning from circulation, either pulmonary or systemic, and that blood flows passively into the ventricles. Right ventricle, left ventricle, looking down here, over here, looking at a cross section or a frontal section, blood flowing in to the left ventricle, which is shown here, passively through this open valve. These 2 valves that I'm talking about right now are the AV valves. So the tricuspid and bicuspid, or mitral, is also the bicuspid. These atrioventricular valves are just hanging open. So the mechanism by which they open is just hanging. When there's relaxation, they just hang open. So blood flows passively through the valve that's in this septum. So that's how these atrioventricular valves open. At the same time, so during ventricular relaxation, the semilunar valves, these 2 are semilunar valves, pulmonary and aortic, they're closed. So they're actually a lot firmer structure, and they are such that they're rigid, and unless something opens them, they're going to be closed. So this is what it looks like right here, closed. Yeah. So now what we're going to do is have contraction. The ventricles are going to contract. That's all the muscle around here, including the papillary muscles. So when we have contraction, we're going to have contraction of the ventricular muscle, the myocardium of the ventricle, as well as the papillary muscle that's kind of embedded in there. So what's going to happen when we have contraction? Can you kind of imagine predictions of what might happen if this gets full of blood and then you have contraction? 2 things are going to happen. 1, those AV valves will be pushed shut. They're going to be held in place by these strings here, holding them kind of like a parachute, keeping them from flowing back the other way because they're so floppy. The papillary muscles are going to help contract and hold those chordae tendineae tight. So I'll show you this picture in just a moment. 2, the semilunar valves are forced open because that contraction increases pressure in here and forces blood out through those semilunar valves. So this is what that looks like down here. We've got the AV valves that are now closed. That happens because this is all full of blood, and When you have contraction, it increases pressure. So it's going to push this way, which closes the valve. These are going to stay in place though because of these cords and these muscles holding those cords tight. The other thing that happens is the semilunar valves are forced open because of that increase in pressure pushes them open. So I've got a diagram of each of these separately to walk through here. Here's the AV valves, passively open, blood flowing through them. When they close, when there's contraction, all the blood is in the ventricle now, and contraction is going to push back and cause these to close, but they're held on in place by these chordae tendineae right here. Semilunar valves, different mechanism, right? So as the ventricles contract, ventricular pressure rises, forcing the semilunar valves open. Again, so that's opening. When the blood flows out, pressure drops inside the ventricles, and the blood's out here now, pushes them back closed again. The pressure's now up here instead of down here. We'll look at these again, the valves opening and closing with the cardiac cycle when we look at pressure and volume changes during a heartbeat.